Hey everyone, this is Dr. Jonathan at Kalkstein Chiropractic, your Baltimore area chiropractor. And today we have Jen. Jen came to us with low back pain into her hip, and it's been about 3 months now. Do you want to talk about a little bit about your hip pain and back pain, and then what we were doing, and then what you're doing now?
Sure. So it kind of came on sort of suddenly. I think a lot of sedentary lifestyle with my job agitated some things in my back, and I decided just to try chiropractic care to get it fixed. And so I came here and happened to get connected to Dr. Jonathan, who adjusted me. He did soft tissue manipulation, which was my favorite, dry needling, and some heat and stim, and it brought me back to life pretty quickly and brought me back to mobility very fast. And Dr. Jonathan's been very great. He has moved at a pace that I'm very comfortable with. I was a little apprehensive about chiropractic care at first, and he explains everything very thoroughly, and his adjustments are very gentle, so it's been great. Healed fast. So now I'm doing the, I think it's called functional strength training program, and so that now is like, I call it like PT and personal training. It's like what I would like describe it as to people. So it's teaching me how to work out safely, correct form, how to strengthen my body in ways that I don't hurt myself again, and to keep myself strong and mobile.
That was perfect. I didn't even tell her to say all that. But man, you nailed that. That was beautiful. So like Jen said, first time coming to a chiropractic office, she kind of realized that we don't just do like adjustments. We do a lot of physical therapy modalities as well. And now that she's in the strengthening program, the whole purpose is to strengthen some areas that have been maybe dormant, and a lot of compensatory elements or structures come in play, which then can make pain kind of creep back. And we want to help our patients feel empowered so that they have tools that when they don't come in and see us, that they have things to reduce their future flare-ups and pain. So happy that you're now at the stage of care, crushing it on the floor. And what a good way to describe the functional strength program as far as the PT physical therapy part with like the feeling of having a personal trainer too on the floor. So you nailed that.
Yeah, well, it's high fives and fist bumps all the time.
Yes.
It's very supportive.
That's so accurate.
Yeah.
We have so much fun here.
Yeah.
So enough talking a little bit of what brought Jen in. If you've seen our other videos, especially mine, I talked about gluteal tendinopathies and what that entails, and also with our videos, lumbar disc referral pain. So Jen had a kind of a double crush where her disc in her back was kind of referring pain into her hip. We kind of cleared that up pretty quickly with a lot of tools in house, and then she got into a pure tendinopathy in that glute tendon, which if you guys remember which tendons are they, comment down below. But let's get started. We're going to lay on your back for me, please. What was the scariest adjustment or thing I did first that you were kind of like hesitant or timid about?
Well, you didn't do my neck right away because you knew that I was nervous about that, which was nice. You listened to me. The very first one was probably just the most nerve-wracking because I was nervous. I had never been adjusted before.
Sure.
But after that, kind of got over with. Everything else is just awesome. It's just relief and a nice release. It feels good.
Awesome.
I always feel nice and like stretched out.
Yeah, kind of warm up her tissues a little bit by getting some stretches into her glutes, and that usually helps get a little bit better adjustments into her spine and also her hips too. So you're gonna feel a little tug. And do the same thing here. We also have very similar taste in music. So growing up, all you, what are we, millennials now?
I guess we're millennials.
Something like that. But punk emo bands out there, you followers, drop some of your favorite punk emo bands. So I think we talked about a few. Taking Back Sunday was one of them.
Taking Back Sunday is one of them. Probably the band I've seen the most.
Yes.
My all-time favorite band is Jimmy Eat World.
Jimmy Eat World, that's right.
Yep.
In the middle.
Yep.
Yeah, see. We're going to go on your side facing me now.
Okay. You also always make sure I'm not going to feel like I'm falling off the table. Very, I feel very protected and safe.
Very important because these tables are super narrow, and it's definitely a feeling that most people feel when they get into the setup that we have to get this area to get rolled over enough, and sometimes patients feel like they're about to fall off.
Yeah.
I reassure them that that has never happened and never will unless the patient does it voluntarily. So you're gonna feel a little pressure. And big breath in, easy exhale, let this roll. Beautiful. And if we had our mics on, then fireworks. Am I right?
Yep, I felt it. It was good.
It was perfect. So, would you say, Jen, out of a week now, how often, if any, do you get flare-ups?
Since, like, how many weeks since I started? I don't think I felt any flare-ups after that.
Nice.
Something like that.
As beforehand, was it like a daily thing?
Yeah, it was like a constant thing when I came in.
I love that. You are now having no symptoms.
Yeah.
Maybe just a little soreness from the workouts.
Yes, they awoke some muscles.
Oh, yes. Good.
You just cracked me just there.
I know, I felt that. So in our other videos, we emphasize palpation, find out areas to adjust. And there's different ways to do it, but this side is actually really good. So there might be a few clicks. And then loose. There we go. That required a little double.
Little baby.
Yeah.
On that one.
Like Jen said, we kind of took her time with the neck because she was a little timid, as most people are coming to a chiropractor. But we reassured her that what we're moving is not necessarily we're not putting bones back in place. We're kind of restoring motion back to the joints. Even though she came in primarily with low back pain and hip pain, the whole system's kind of connected. And if one area of the body isn't functioning well, that can also affect other regions of the body. So those of you who are wondering why we adjust other areas of the body, that's why. So we want all of our patients to be functional in all areas of the body and move biomechanically really sound. And this one right here. So we'll try to be super quiet so maybe you'll hear it. Big breath. Easy exhale.
I heard it very loud.
I heard that.
It is very loud in your head. Somebody warned me that.
Yes.
Like, just be careful, it will be loud in your head.
That is a common thing. Just because it's so close to your ears that it's super loud.
Yeah.
But if you have an experience, what are you doing? Come in our office, have fun with us, and experience it yourself. So this side, I do a lot of pull rather than a push. And drop that left shoulder more. Beautiful. And then this one is our favorite.
Oh yes, the hug.
The hug. So this is for her first ribs, and we're not in the right room with the posters, but it's right if you find your collarbones and then go directly back and up, you're gonna feel it right there. So I call this one the hug because she wraps her arm around me, I roll, and then I contact my spot. Nice and easy. And not so much audible wise with that, but was that pretty gentle?
I could hear it, but yeah, I felt good.
Let's do this side. And same. Boom. That's gonna be it. Let me bring you up.
Okay.
Shout out to Jen's fabulous hair. We both got the locks of love. And
It's a little frizzy from working out.
That's alright, still very nice. I don't know if you guys, this is my first video, maybe back from my long hair. If you guys, this is your first time seeing my hair, hope you guys like it. If not, I don't really care because I like it. That is it for this video. If you have any questions, comments, write down below, and then next time we will see you.